There is a massive scandal here. Is a dodgy, unqualified immigrant working in your loved one's care home or even coming round to their house every day? There is a deadly cottage industry of people paying thousands of pounds to crooks to lie their way into Britain, Britain's care homes and the actual homes of the elderly and infirm. Here is undercover footage obtained by the Mail showing a Baptist minister asking for £9,000 in cash to guarantee that a woman with no qualifications can become a home carer in the North East. I suspect this will be happening everywhere. Here are the sickening facts. We had 164,000 care home vacancies in 2021, apparently. The government then relaxed the entry rules to make it easier for immigrants to work in the care sector. Britain granted 337,240 work visas in 2023, 26% higher than in 2022. This includes 146,500 health and social care visas. That is apparently a 91% increase on the previous year. They also brought their dependents with them. 73% of family visas were reportedly for people working in the health and social care sector. That's around 204,000 people. How many of these are dodgy? Companies need to sponsor care workers to be granted a visa. Some of these companies are bogus, with copy and paste websites, fake-looking reviews and PO boxes as addresses. Some companies have never filed accounts and are only a few months old. At least 268 companies that have never been inspected by the Care Quality Commission have also been granted licences. Others appear to have been granted licences by the Home Office despite not being registered with the watchdog at all. The Home Office issued 275 visas to a care home that didn't even exist. This was revealed in a report written by David Neal, who was appointed as the Independent Chief Inspector of Borders and Immigration. What happened? Well, he was sacked, wasn't he? Possibly because he didn't keep his mouth shut. We already have a total scandal of patients dying in some cases because foreign care home staff, unable to speak English properly, can't explain their symptoms to 999 call handlers. What kind of life have the elderly and most vulnerable people in society got if they can't even understand their own carers? And now it turns out that loads of those carers won't even be qualified. They are literally just random foreign people who have paid thousands of pounds to a criminal to lie their way into Britain, and they've probably brought their families with them as well. But this is the government's fault and nobody else's. Instead of training more British care workers and paying them more money, they decided to just flood the market with cheap foreign labour. And by the way, they're about to do it with teachers as well. Overseas applications for teacher training have doubled this year in an unprecedented increase after ministers began a recruitment drive in countries like Nigeria and India and offered £10,000 payments for foreign teachers to come to Britain. But back to the care sector. It makes me sick that this is how we treat our greatest generation, our elderly, our most vulnerable. People who have paid their tax all their lives, worked hard, done the right thing. And bear in mind that only about 1% of abuse claims in care homes actually result in a conviction, so they've got that against them as well. Nothing sums up our broken immigration system more than somebody with no qualifications whatsoever being given the key to an elderly dementia sufferer's own home.